When you look into the eyes of your son or your daughter and they're an addict, you have to see that to believe it. It's a sick feeling. You're watching your child die right in front of your eyes. I've told people this, I would rather my child get AIDS than to be an addict because it's easier to treat AIDS by far. Make no mistake about it, it's affecting our entire country. It can happen to anybody.
The Centers for Disease Control and Prevention says the opioid epidemic is getting worse.
This is the epidemic of my generation. This is my HIV, this is my Black Plague.
A stark new report shows the opioid crisis seems to be deepening across the country.
This is the worst drug addiction epidemic in United States history.
Overdoses are increasing at an alarming rate.
Since 1999, more than 300,000 Americans have died from an opioid-related overdose.
Our country loses more people to overdoses, prescription drug overdoses, than we lost in the entire Vietnam War. I mean, that's a staggering number.
But we're experiencing that right here in Oklahoma. In fact, if you looked at the map of how the opioids are advancing across the country, you would see the state of Oklahoma rise out of that because of every county in our state is seeing a rise in opioid deaths per 100,000. We have counties in our state with 15, 20, 25 deaths per 100,000 in our state. That's unheard of in most of the rest of the country.
Last year in Oklahoma, we lost more Oklahomans to prescription painkiller overdose than we did in every car crash on all of our road, bridges, and highways put together.
I think Oklahoma is in a crisis they don't realize they're in. They seem to think that the opioid addiction is still something that's out in other places. It's not, it's here.
It affects everyone, every person in this state. If you don't think you know someone who's addicted to opioids or someone who's being affected by opioid addiction in their family or in their life, it's just because you're unaware of that. You're ignorant to that fact. It affects everyone.
Well, the opioid epidemic is unique among most drug epidemics in that it is not picking which social class, and it's decimating the entire society at all levels.
It's like nothing we've ever dealt with before. The sheer numbers of people, when you look at the overall society who takes pain pills, so many of us do.
One of the struggles we have with opioids is that people believe that it's safer because it's medication.
And what's very basic about the opioids, it's a very effective painkiller, opium is. You know, somebody hurts their back, say lifting weights in a gym, and they go to a doctor, and that doctor puts them on some muscle relaxers and painkillers.
This doctor, has given me this pill. It's not in a small baggie, and I don't smoke it in a pipe or shoot it into my arm. It's a legitimate prescription. And hey, this has got to be okay. My doctor's prescribed this. And he gave me a 30-day supply.
The reality is that patients who take an opioid every day, a few times a day, for a week or more, 100% of patients are going to be developing what we call physiological dependence on the drug. And if you take an opioid every day for 30 days, more than 40% of people are on an opioid a year later. So physiological dependence will happen to everybody, and it can make it very hard to come off.
Essentially, what opioids are a version of heroin.
The effects produced by hydrocodone or oxycodone or heroin are indistinguishable. An experienced heroin user cannot tell one from the other. 95 million Americans were prescribed an opioid in 1 year. 95 million Americans were prescribed a drug that's every bit as addictive as heroin.
And we were at the top of the list for the number of people who were being prescribed and the number of prescriptions we had available and pills in our community.
As the prescribing went up, rates of addiction and overdose deaths went up right along with the increase in prescribing. It's not a drug abuse problem, it's an addiction epidemic.
However, what happens when they take that pill is it changes the brain. Their brain chemistry has changed and their life is forever changed. So it tells me that it's not a personality flaw, it's not a character flaw. This is a biological mechanism that happens. If Mother Teresa's on these medications long enough, she'll become addicted.
In every way, it is an illness. You know, if you have more willpower, if you were raised better, whatever, that you could exercise control over this. And I promise you, none of my patients suffer from lack of willpower.
The power of addiction, it's unbelievable. It makes people do terrible things. It makes law-abiding citizens break the law. Mothers will steal from their own children. Fathers will let their children go hungry to feed their illness. And indeed, children will break the hearts of their parents, all because they're sick.
They're not just gonna say, my doctor won't prescribe any, therefore I just won't use today. And so that has forced some of the people to go out on the streets to get the opium, whether it's through black market prescription painkillers or whether it's through heroin.
But I've seen normal people turn into monsters and kill. I've seen people kill over this drug. The addiction is more powerful than anything that I could even describe.
It's important that we step up now. It's important that we do something together to fight this opioid crisis. It's something that's going to affect not only us and our children, but generations to come if we don't do something about it now.
It's like a rock in a pond. It's going to ripple outward and it's going to impact public safety, which impacts law enforcement. It impacts our workforce because that person not getting treatment is not showing up at work. So now everybody at that business is having to make up the slack. The person on the highway with their family on the turnpike who gets hit head on because this person didn't get treated.
We're losing somewhere close to 1,000 Oklahomans a year to overdoses. Somewhere in excess of 800 babies are born substance impacted, which means they go into withdrawal hours after they draw their first breath. Victims of this are real people, as far as I'm concerned, most of the time blameless.
I remember sitting there in my jail cell. I said, I don't want to be like this. I don't want to be that drug addict.
It's a pervasive problem and it affects every Oklahoman. Our DHS, our foster care system, I mean, it's like a fabric that weaves throughout all of our society, is powerfully disruptive.
This is the most urgent public health problem facing the country, and we should be doing everything we possibly can to bring it under control.
We need to talk about addiction. We need to not be embarrassed or ashamed. We need to say it happens in most families. It happens to good families. It happens to all families. It's a disease.
We can address this issue just like any other public health epidemic, but we have to start with discussion.
This is hard to talk about. You can't even imagine, really, losing your kid. I had no clue what was coming.
You know, he was the homecoming king at Westmore High School. He played on a national championship football team. He was loved by everybody. The worst thing he ever did, he became addicted, and he killed his girlfriend in a car accident and ultimately died himself in a vehicular accident because he was an addict.
He got addicted to opioids, and he simply became a slave to them. Once he tasted opioids, there was no looking back. We all have pain, and we all would like to kill pain. But the pain that lives in our hearts when we deal with an addict, that's wrong. We've got to kill that pain too. People need to talk about this.
On the next episode of Killing Pain.
People with opioid addiction look like me, they look like you. They are our friends, they are our family, but it looks like me and you.
The doctor prescribed me Lortabs. He said it's for a short time, it's going to help you relieve the pain that you have. Taking that first Lortab, I would have never seen myself going down that road from handfuls to meeting the Mexican cartel for heroin, to shooting it up, to running from the police. That little pill will cause destruction through your whole life.